everybody, it's your girl, it's Kelle. Ooh, I'm fixing my hair because it's Warrior Wednesday. It's Warrior Wednesdays? Like what? I haven't been here in so long. I have literally been in Warrior retirement. I have been blessed to work. I have been writing for television. I have been doing all of these wonderful things, healing, all of those wonderful things. And now I finally have not only the time, but the reinvigorated spirit to talk to you guys on Warrior Wednesday. So welcome back. Somebody says it's my birthday. True to ATL. Happy birthday to you guys. I want you to go ahead and put in the comments where you are joining from so that I can say hello to you specifically. I'm waving back to you guys. I am so excited to have well, first of all, she was the first Warrior guest ever. The first doctor that I ever spoke to online about frozen eggs and endometriosis and fibroids and all of those things ever. And she has been a part of Warrior Wednesdays since the beginning, over and over and over again. She has lent her wonderful time to answer your questions and to be here and to encourage us and to educate us and to keep us healthy and to share in everybody. So people are telling me they're from Texas. What's going on from Texas? How are you? From Sharon Hill, Pennsylvania. That's my home state. Baltimore Cade Foundation is in here. Y'all, what is going on, Dr. Camille Cade? I'm so glad that you are here. Mama Stu is in the building. Hi, Mama Stu. She says, hey, Boomerang. Okay, you guys, I want to thank you for being here because we are kicking off Fibroids Awareness Month is right now. So we are going to be bringing in my dear friend. She is Yale trained. She is Johns Hopkins trained. She is a dual virologist, which means she studies viruses like COVID that we're all still living with, y'all, as well as a fertility specialist. She is the head of the Nevada Fertility Institute. She is a baddie. A baddie. And she is my friend and she is here today. Coffee, what's up? I see her in the building. I'm going to bring her on. Without further ado, I am bringing on... I'm biased and I don't care. Dr. Cindy M. Duke, my friend, warrior doctor, and just PhD, FACOG, MD. What's up, Cindy?
Hi, Kelle. Hey, everybody. Oh, my gosh. It's so good to be back. This is incredible. How have you been?
I've been so, first of all, you look fabulous. I saw.
Thank you. Thank
yes,
you.
I see the hair and I see the waves, and I have to give you all of the credit here because, y'all, when the Supreme Court reversal of Roe Wade happened, Dr. Cindy M. Duke reached out to me, and she says, sis, we got to talk about some things. We got to talk about some things. And I said, how long has it been? And I think you told me it's been about 9 months that I've been.
It's like 9 months.
that I've been hiding in my computer. And I said, girl, we could have both had a baby by then.
We could have.
But we could have. But you know what? Thank you for bringing me out of Warrior retirement. And thank you for caring about this audience and this crowd so much that you wanted to be here to make sure we talk about all the things. So we're going to get into the Roe v. Wade of it all. But first and foremost, we're going to talk about Fibroid Awareness Month, which is right now. So can you explain to us and those that are just joining for the first time, and we'll get into some in-depth things, what a fibroid is, what are the symptoms of fibroids, what should people be looking out for?
Yeah, so I think it's really important to acknowledge that we finally have Fibroid Awareness Month. We didn't always have a formal acknowledgement of this. And fibroids are really, really common. You know, 7 out of 10 women, if you took all women in the world, 70%, and people born with uteri, I don't want to be non-inclusive here. If you took everyone who was born with a uterus and checked, 7 out of 10 will have fibroids at some point in their life. And then if we honed in on Black women, 9 out of 10 of us will have fibroids. Kelle, I can tell you for sure, I have fibroids. I know it. I've had symptomatic fibroids that have plagued me since my 20s and definitely threatened my life twice in my 30s Fibroids are very common and they happen to all of us. Symptoms of fibroids, they vary. It depends on where your fibroids are located. As you know, I like to say with fibroids, they're like true real estate, right? Location, location, location. So for some people, they have fibroids and they have zero symptoms. And it's just what we call an incidental finding. You know, you're having an ultrasound done, or maybe a CAT scan or an MRI for something else, and they happen to mention, oh, by the way, we see a fibroid there. And so it's also important to point out that just because someone has a fibroid doesn't mean they need treatment. It doesn't mean they need to start worrying that surgery is around the horizon. What we do interventions for is if someone's fibroids are causing symptoms. So we usually put symptoms into one of two categories. You can either have symptoms due to bulk, which is, you know, you're feeling bloated, or maybe the fibroid's like sitting on your rectum. And so whenever you go to the bathroom for number two, it's uncomfortable, you're having to work hard, or your uterus is so big and bulky that whenever you're having penetrative intercourse, it's really uncomfortable. It now feels like someone is, you know, pun intended, but not, is like someone's trying to push something too much into your body. So that's what we call bulk symptoms. For other people, their bulk symptom is it's pressing against their bladder. And so they just accumulate a little bit of urine, but they've got to rush to the bathroom to pee every time. They're just really uncomfortable. So that's what we call bulk symptoms. And then the second, more urgent symptoms relate to blood loss or heavy periods. And that's when your fibroid, even if it's really tiny, is sitting in the cavity of the womb. Every month when you have a period, it bleeds. And so that thing has its own blood supply. And instead of just bleeding what we say is the usual period, which is about 6 to 8 ounces per month, you're hosing out like a pint, 2 pints, 3 pints of blood in one period. I have to tell you guys, I've had that happen to me. And even as an OBGYN in training, I ignored it. A lot of people who are menstruators ignore heavy periods, or it's normalized. I grew up in a family where everybody had heavy periods. And of course, we didn't know about fibroids, which is fibroids run in families. So yeah, my mom had ridiculously heavy periods. She would tell me stories about, you know, she lost her mom at 16, but she remembers her mom using bed sheets, Kelle, as pads. Right? And a lot of people listening right now have families who've probably had that experience. And so we normalize it. When your younger person starts having heavy periods, we tell them, oh yeah, we get heavy periods in our family. That's what we do. But you know, I had at one point bled down to a hemoglobin of 5. And let me explain what that means.
Yes. Can you explain what the
Let me
hemoglobin
explain what that means. So hemoglobin is the protein in our red blood cells that carries oxygen. We need hemoglobin to live. That's what your heart uses as its gauge to know how well it's feeding the rest of the body. Normally, for someone who's a menstruator, our normal hemoglobin is between 12 and 16. Average is 14. Mine was down to 5. 5 is when you start wondering if somebody is able to stay vertical, if they're able to actually function. I would be honest with you. I was having symptoms and I chalked it up to exhaustion. The first time it happened to me, I was in residency. Yeah. And I see this with so many women so many times. And this is my first time sharing this publicly, but this is what I understand, because I was a resident, and the only reason I'm talking about it today is a Facebook memory popped up from 11 years ago. And as I was reading the memory, I realized, my God, that's when I was in just the heart of my severe acute on chronic blood loss anemia is what we call it. And I used to have periods so heavy that I would be wearing an overnight pad and had to change it every 30 minutes. I would be in C-sections, and because it's an emergency C-section, I can't leave. By the time we were done, I was standing in my own pool of blood because I soaked through whatever I was wearing, the tampon and the pad that I was wearing in combination. I soaked through and it ran down, but you know, first things first, I got to take care of this person and their baby. And so that was my life. And what happened was, I remember distinctly the day I realized I've got to do something. I had worked a night shift, and then I went straight to clinic, because that's what they would do if you did night shift. You'll go to clinic on Friday morning after working all night. Doctors' lives, it's crazy. And so I finished clinic at noon. I finished clinic at noon, and I left the building intending to walk to the parking garage there in Baltimore, and I couldn't make it. I had to sit down on the pavement in Baltimore, and I was like, am I having a heart attack? What's going on? Because my heart was like just like hitting my chest so fast. I felt like I couldn't try to stand up. And I was like, oh my God, I can't believe I'm going to die here. So I'm like, do I have cancer? My mind went to my family's story, and I'm like, maybe this is type 2 diabetes just hitting me, boom. But I managed to muster enough strength to hold on to the rails, and I walked myself to the outpatient lab that was nearby, and I ordered myself some blood work, and then I called a taxi and I went home. Around 2:30, my pager goes off, and I get a page, Kelle, and it's the lab. So I call them, but I'm also logging into my computer because I'm like, it's got to be my blood work. And so I call, and they do their usual verification, which is she asked me for my name and my provider ID number. And then she said, wait a minute, are you the doctor or the patient? And I said, I'm both. I ordered the labs for myself. And she said, I can't give you these numbers. These are urgent, critical numbers. I can't give this to you. And so now I'm like, oh my God, I'm really trying to log in. And I see the hemoglobin of 5.0, which is like, you know, you got to be admitted. So I give her the name of a doctor who's one of my colleagues and attendings. And before I even hang up the phone, she's paging me, and her page was SOS, are you alive? And
what?
So, yeah,
because
so
this this number
this is
are
an
we
emergency.
talking almost like blood transfusion number? Is
Oh,
that what
it's blood transfusion number is 7, hemoglobin of 7, right? I'm down to 5. And so, but I'm giving this example because I also want people to hear that I'm like you when I was that first patient, the first time I had to be transfused, because ultimately I was transfused, but not that day. I fought. Dr. Cindy, who knows everything and knows the threat, when she called me, she said, Cindy, are you vertical right now? What's going on? You need to come to the hospital now. I said, no, I'm going to try to see, you know, I'm off for the weekend. I don't work again till Sunday night. It's Friday afternoon. Let me see what I can do for myself. And so I decided I'm going to try to eat my way healthy that weekend. The Southern Caribbean gal jumped in. I ordered from the supermarket that was just downstairs of me. I ordered beets. I ordered all the things, you know, steak, all sorts of stuff, because I was going to eat.
you're trying to get that iron up. You're going to eat and get that iron up.
And
yes.
as I spent that weekend, I also started for the first time really paying attention. And I realized that for the past few months, I had been just chalking up my symptoms to extreme fatigue. I remember one day, my friend who was another resident, Madupe, and I were walking down to the inner harbor. That we usually do that walk briskly. And we're both tall. She's 6'2", I'm 6 foot, pretty much. And we're walking, and she turns to me and she's like, dude, what's wrong with you? And I was like, oh, I don't know, I'm just really deconditioned. I gotta get back to the gym. And I'm like making excuses, right? And she's like, dude, you don't look good. So we lean up against a railing near the convention center, and we, you know, I'm breathing, and she's like, you really think this is just, you know, and I chalked it up to that. I remember once we got an urgent call to come to the emergency room for a woman who was crowning, actively delivering. And we set off running, myself and one of the high-risk OB fellows. And I stop at the elevator because I couldn't make it. And he says, what are you doing? This is an emergency. We got to take the stairs. And I said, I'll meet you down there, because I could feel that my chest was tightening up. So the truth is, when you get that anemic, if your heart doesn't get the help it needs, because the body is telling it, hey, we're out of oxygen, what's going on? The brain is saying, hey, I need oxygen. The body needs oxygen. The heart starts beating really fast. So if you only just try to increase your activity, now the heart is going way past its limits. And I started realizing that if I went from sitting to standing, I had automatically adjusted myself. So I'd always just brace myself before I stood, because I would get a little dizzy. And I realized, this has been going on for some months.
So now you're getting adjusted to
that weekend.
Ill.
I started realizing, Cindy, you're really sick. If I went to the bathroom and sat on the toilet, I would literally brace the wall to stand up off the toilet. And I had stopped taking warm showers, because the truth is, whenever you take a warm shower, your blood vessels dilate so that more blood can come to the skin. And my body couldn't handle even that change in blood pressure. I would get really dizzy in the bathroom taking a shower from my severe anemia. So I'm sharing it because I know there are people right now listening to this who've been experiencing that and coming up with all sorts of excuses for it, even though they know their periods are crazy heavy, even though They know, you know what, I've been meaning to go talk to my gynecologist about this thing. So fibroids, that's the one that's really emergencies, when your periods are heavy. So by the end of that weekend on Sunday, I called back that colleague slash attending. I said, you know what, I realize now that I actually have really severe anemia that's symptomatic. I'll take the transfusion. And she says, let me see what I can do. I said, but I don't want to be admitted to the hospital. I don't want the nurses knowing my business. I was still very full of pride, you know, and I didn't want people to know that I'd let myself bleed down to a hemoglobin of 5. And so she said, hold on, let me see what I can do. So she calls up the chief of hematology, and he says, you know, if she's available, she can go to the cancer center on Monday, and we'll transfuse her at the cancer center as an outpatient. So that Sunday night, I went to work. And then Monday morning, I got up from call. I talked to the chief who was online, who I forever hold in my heart. It's one of my colleagues, Dr. Frank Aguirre. And I said to Frank, I said, listen, I don't want people knowing my business, but I'm going in to get transfused 3 or 4 units of blood today. And he says, you're not planning to come to work tonight, are you? And I said, yeah, I'm planning to come to work tonight. And he's like, Cindy, please at least take a night off. Yes. And just let your, so I went in, and I kid you guys not, I wish I had all this social media acumen back in 2011 when my transfusion happened. But when I sat down and she did my vital signs before my first unit of blood, my heart rate was 143, 143, sitting down, relaxing. And my
so your heart, basically, y'all, her heart is doing this. It's racing, and you're sitting.
Yeah, because it's trying to get blood and oxygen to the body. So I watched the first unit of blood go in, and I go from 143 down to about 120. After 120, the second unit goes in, and I'm down to like about 98. Third unit of blood goes in, and my heart is now at 60 something, which is actually the heart rate I was used to. I was used to doing that, used to running. And in that moment, I realized that it was a matter of time before my heart would have given out, because it was working really hard. Because I hadn't slowed down. I was doing everything I normally do. I was still going to work, still trying to push myself, still trying to walk fast, you know, just doing all the things you normally would do. And fortunately, I was young and otherwise healthy, so my heart was compensating. But imagine if you're someone with some other underlying illness. Imagine if that's happening to you and you're also maybe diabetic, or you have high cholesterol, or you're a smoker, which changes how your blood vessels react to changes in oxygen and so forth. Imagine if that was, and after that, you know, I called my mom and I bawled. I cried. I cried because I realized in that moment I had been flirting with my own safety, but chalking it up to residency it's tough. I'm a resident and I'm exhausted. Suddenly I realized, so I didn't go to work that Monday night. I stayed home and I slept, even though I had texted Frank and said, you know, I could come in. I feel great, because after the first unit, they really ran the other 2 units in quickly. So I was actually home by 1 p.m. that Monday. And so I was like, listen, I could take a nap and I'll come in for my shift maybe an hour or 2 later. And he's like, please, just stay home. I'm going to cover you. My wife, I already talked to my wife. The kids, they're fine tonight. Just come to work tomorrow evening. And so I realized, excuse me, I got home, went to the bathroom, peed, shut up, no problem. I wasn't steadying myself, right? I took a shower, an actual warm shower, did fine. No nausea while showering, no bracing myself. I had days where I would show up to work, Kelle, and just trying to get out of the car in the parking garage. When I thought back on it, I would brace myself to slowly get out of my car, or else I'll get really nauseated, because that's what we call a vasovagal response. The vagus nerve controls your blood pressure, your heart rate, and it also controls nausea. And so that's what was happening to me whenever I changed positions rapidly, is that nerve was trying to activate the heart, and it activated all the other symptoms. So yeah, I would instantly get nauseated, ready to throw up. Like, I'm in the parking lot and I was like, people are going to think I'm not sexually active, but they're going to think I'm pregnant or something. Right. Here I am, just getting nauseated when I change positions. I'm getting nauseated when I shower. And here's the other thing that happened, guys, that led to me taking a lot of control for a lot of years, was when I went to do my follow-up for my blood count, the doctor says, you know what, I'm a little concerned here because this wasn't my GYN. I went to the university health services. Your platelets are in the millions. And to put it into context, platelets are usually in the thousands, the low thousands, right? And my platelets were in the millions. And he's like, you know, they were really high with your first blood draw, which was pre-transfusion, and they're still really high. I'm concerned maybe this is a leukemia. I don't know what's going on. Maybe that's the real reason for your anemia. And I remember I left his office and I was walking down that street leading to the hospital from the hematology clinic. And for the first time, I was faced with the prospect of something that might take my life. Now, it turned out not to be a cancer, and it turned out to be perfectly related to my blood loss, which is your bone marrow is what makes cells, your red blood cells. And so it meant my body had been sending my bone marrow a bunch of messages saying, can you do better? Can you do more? And so my bone marrow was just doing what it could make, which is it was making platelets. Now that many platelets, though, you could end up with a blood clot. So that's the other thing that could have happened as a result of my extreme anemia, is my body trying to answer the call for what it needed could have caused me a problem. So in the subsequent 2 months, I went in for weekly iron transfusions. I went on medicine to stop the bleeding, stop my periods completely, so I could actually give my body time to recover. And my platelets came right back down to normal, because what I had is what we call a reactive leukocytosis, which is a fancy word for when your white cells and your platelets and everything just activates, trying to make up for the fact that the bone marrow doesn't have iron to make hemoglobin. Heme is the Latin word for iron. In order to make hemoglobin, it needs iron. Iron is what carries the blood, but I'm losing so much per month. And so that happened. And I have to say, guys, I took steps, I got it addressed, and I was fine for a long time until last September, Kelle, which is when I had to be admitted to the hospital again with a hemoglobin of 4.7. And this time was because I was sitting in my office after a really busy day, and something in my brain just said, you know, if you're being honest with yourself, these symptoms are very similar to what you realize you were feeling back in 2011. And so I call our phlebotomist. I said, can you draw some blood for me? And she drew the blood, and I got the same thing. I got the stat call from the lab. And so I had to reach out to an OBGYN colleague here in Las Vegas and say, can you help me? I need to be admitted tonight for blood. And I went into the hospital, got transfused overnight, and went back to work at 6 a.m. that morning because I had procedures to do. But with that one was like, okay, you're much older. You're now in your 40s. And your body is different. Because this time I couldn't even climb stairs. I would come home and sit on the landing in my house before I would seat my way up the stairs. I didn't climb, I'm not gonna lie. I sat and moved up stair to stair to stair. And that was when I realized also, someone wrote, no superwoman. We do have that tendency to be superwoman. So that's what I want people to use Fibroid Awareness Month, to realize that you don't have to be the super anything, the superhuman. And when it comes to your periods, you've got to take control of it, because it's your life. You know, like I tell people, your period is a vital sign. It's a vital sign. Just like your blood pressure, just like your heart rate, just like your oxygen levels. And way too many of us ignore heavy periods. And then when things start happening where we're feeling the heavy period, we ignore it. For those who are actively trying to conceive, the fibroids in the uterus can be leading to miscarriages. They could be getting pregnant, but it's not staying. And by the way, I see someone who I know on there, Lauren. I'm so sorry about today. And I know we're going to talk tomorrow.
We're going to talk.
I mean, you know, but I want people to know that fibroids impact everyone. 7 out of 10 women will experience fibroids, but especially to those Black women and brown women listening right now, fibroids occur way more frequently in our populations, and we ignore it, or we've been normalized to leave our heavy periods, our uncomfortable intercourse, our bulk symptoms to not mean much, because our families say, hey, that's all of us, you know, what makes you so special that now you're complaining about heavy periods? Women for generations in our families have lived with heavy periods. But that doesn't make it normal, guys. It doesn't make it normal that you have to be so exhausted every month that you need to miss days from work, or you're at work and having to put so much more effort into it. It doesn't make sense that you have to be so exhausted that
okay,
you can't really participate.
Let me say this to you, my sweet friend, because I want to you see my hands, because I want to help you through this. I need everybody that is on this live to put a bunch of hearts, I don't care what color, to our dear friend Dr. Cindy M. Duke for sharing a triumphant story of learning her own body as she was discovering how to care for ours. And I might be getting a little bit emotional here, friend, because as long as we have been doing these lives together, you never shared this story, and I never knew this of you. And I want to find a way to show my gratitude to you for trusting this platform to be a space that's safe enough for you to be that transparent, because you probably just saved many lives with your truth. And I know you save lives with your hands all the time. I know you bring life into the world with your hands all the time. But through your mouth and through your heart, you sharing your experience and all that you went through, it definitely changed me. And I want you to know that. I want to thank you for doing it in this moment, and trusting this community that we've built in Warriors to hold space. So I hope you see all those beautiful hearts that are coming your way. And
thank you, everybody. I didn't mean to share so much, but I thought it also necessary, because way too many of us, we downplay it, you know, and we're afraid to talk about it because people are going to think you're trying to miss days from work. And I never miss days from work. You know, and I wanted, because I diagnosed patients with blood clots to their heart and lungs, and people like unexplained blood clots. And then we look at their counts. I'm like, well, she's really anemic. I have a feeling it's her anemia that led to this PE, or this blood clot, because you couldn't find any other explanation. This heart attack in a 28-year-old, I have diagnosed 20-something-year-olds with anemia after a heart attack, realizing that it's not the anemia that came after a heart attack. Their anemia led to changes with their heart and their clotting systems that led to the heart attack. So I want people to know this.
I think what everybody really needs to know here is that fibroids, if not tended to, especially if they get larger, especially if that blood supply is there and they continue to wreak havoc, and we continue to normalize periods and things like that, are a life-threatening condition.
Yes.
And
especially heavy bleeding.
Especially heavy bleeding. And there's so many of us that normalize heavy periods, like you said, in the Black and Brown community. Now, can you speak a little bit? There's so many things I want to ask, and
go for it. I'm all yours.
Listen, we're going to do it. But can you talk to us, because I want to talk about myomectomies and embolization. I want to talk about the different ways that fibroids are treated. I definitely want to get there. But can you, because what you said about Black and Brown women, people with ovaries, with uteruses, are experiencing fibroids at a much higher rate. Can you explain, is there any history to that, or a reason why it is in our community? Is there any foods or any health steps that we can be taking on our own? Should we be screened if we have heavy periods? Should we be asking our gynecologist? What steps or tools can we take? And can you give us a little bit of the history? And before you answer that, Dr. Cindy Duke, you guys, if you have questions, and I see a couple coming in, please add them into that little
question
cross
mark
there, that little question mark thing there. Oh yes, I'm sorry, the question mark, so that I can. Oh, I have people trying to join. Okay, no, y'all, this is this lady. Okay, but if you can add the questions right there, if you can add them, we can answer that stuff for you and share this live so that people really get this.
Guys, share the live. The live. Yeah, you know, so I think the big thing is, many times you do have to advocate for yourself. And this is not meant to knock on any physicians out there. It's not meant to knock on any providers. But the truth is, especially when we're talking about Black and brown women, somehow many times your complaints aren't heard the first time, particularly if your provider doesn't look like you. That's the unfortunate story. And so what really happens is, for many women of color who are experiencing particularly that heavy bleeding side of the thing, is they're dismissed. Many times, your blood, it's a progressive loss, right? So you may call this month and tell them your period was really heavy, and they're going to run a blood count and tell you it's fine. And now they're going to dismiss you any other month you call. But the truth is, it's a progressive lowering of your blood count. So the very first month you have this crazy heavy period from your fibroid that's now grown into the cavity, and you call, they may dismiss you. That doesn't mean you're crazy. You are absolutely not crazy. It's because, like I said, the normal range is 12 to 16. Even at 10, they're going to tell you your numbers are normal. But the truth is also, your body, depending on what it needs, may become symptomatic at higher numbers compared to other people. So like, I was noticeably symptomatic the first time at 5, because I had been ignoring it when it was at 6, when it was at 7, when it was at 8, 9, 10. I had been ignoring it. Since then, I've been able usually to catch when I'm down to like 8 or 9. But last year, somehow I didn't notice until I was down to 4 again, right? But I just want people to know that you may notice changes at a number where your doctor's like, oh, it's fine, your number is fine. But it's just because it's still early in the decline. And so stay on top of it. Also,
okay, so it's a progressive decline. I just want to make sure
it's usually a progressive decline.
Okay, now, so that everybody hears that. Yes.
Yeah, you're going to get to the threshold where even 2 drops of blood loss, your heart and your body is like, hey, this is too much, right? Because it's crossed its critical point. But in the beginning, if you're starting to bleed out from a hemoglobin of 14, you may not really feel many symptoms. And when you go in, if you were at 14, but they hadn't been checking and now you're at 12, to lose 2 units of your hemoglobin is actually a lot, but because they don't know that, they're going to tell you it's normal. When you go in at 10,
Regina Townsend says she was told it was because of her weight. I didn't mean to cut you off, but I just wanted to point out things.
Yeah,
no, but
that's another
broken brown egg.
Right, but is she saying that she was told her fibroid growth was due to her weight? Now,
yes, fibroid. Yeah.
Could weight have a small contribution? Yes, because we know that excess adipose tissue, which is our fancy medical word for fat cells, make estrogen. Estrogen is ultimately the hormone that grows fibroids, so it can contribute to fibroid growth. But where I was going with this, when you ask why us, why are Black women and brown women more prone? We do have certain genetic factors that predispose us to growing fibroids and growing them large, right? But also what we're eating and what's put in our food also is bringing more hormones and hormonal regulators or disruptors into our nutrition that also impacts the growth of these fibroids. And so that's one of the things I talk about with patients is we're not just going to talk about medications that can address your fibroid. We're not just going to talk about surgeries to remove the problematic ones, but we're also going to talk about what can you do lifestyle wise to make sure you're not further disrupting those signals that worsen the growth. And so we now know that looking at data, they say certain chemicals used in our hair products, skin products, probably over time further trigger the sort of turning on of some of these genes. Now, I should also preface all this by saying that the research into fibroids and fibroid growth is relatively new compared to studies of things that affect men, let's just be honest. And so things that affect women in general haven't been very well funded, so the studies have been very slow, and especially if they're affecting women of color, they've been even slower. And so I have to be very honest. About that. And that the data is still coming in. But yes, the bad wolf brains question, it's a combination of things. And I hate to disappoint the ones listening here, but there's no natural way to truly shrink a fibroid outside of menopause. Now, I'm not saying this to disrupt anybody's business model, but I think we need to be honest. And like I said, if you're someone out there who's already having the palpitations, already having the symptoms, drinking this person online's tea is not going to help you. It's going to land you in the hospital with a heart attack or something else. And all they're going to tell you is you should have known you were this sick. You shouldn't have taken it if you were this sick.
Yeah,
so I want people to understand
hands,
that.
Put spirit hands.
I want people to hear that.
I am so glad that you are saying that, because we have a beautiful thing with social media that we get to have this conversation live. We get to post it later, and people will get this information. But the other side of it is that people can sell you, people that are not scientists, y'all, that are not doctors, they can sell you a bit of goods that will guarantee you something that's actually not going to happen. Who you are listening to right now, Dr. Cindy M. Duke, MD, PhD, FACOG, is John Hopkins and Yale trained. And so this is who I feel 100% confident that you should be listening to her. So I thank you so much for saying that. Thank you for saying that.
And to the person who just said they force hysterectomy on us, you're not lying. Historically, Black women were primarily offered hysterectomy for treatment of a fibroid uterus, partly because of the silly fertility myth that assumes that any Black woman's already birthed a whole boatload of babies and has no use for her uterus, which is unfortunate. The majority actually either haven't started their family or not done making their families. But there are loads of non-surgical, well, I shouldn't say non-surgical, but non-hysterectomy options available. Some of them we don't recommend if you definitely plan on being able to carry a baby in the future, but there are many options available. And so if you go to see someone about your fibroids and all they're talking about is hysterectomy and you're not interested in that, go ahead and ask for a second opinion. And hey, you don't even have to ask, just get a second opinion, right? You don't actually need anyone's permission for a second opinion.
Right. We sometimes as patients don't feel empowered by our own mouth. We don't feel empowered by knowing our own body. There's sometimes we have to, because, and I wanted to touch on this a little bit when someone said about the superwoman complex.
Yes.
And I want to touch a little bit about the mental health aspect of fibroids, of what it feels like to experience heavy bleeding every month, experience doubling up on pads and accidents that happen, how it affects your sex life, how it affects your confidence, your security. And what I think you laid out so beautifully, you were doing your residency, and this is someone that medically was being trained and working and knows all of the things, and yet and still it was something that we start to rationalize, we put to the side. I'll get to it a little bit later.
Oh, yes.
But can you talk a little bit to your personal experience, and also maybe even patients that you have, about the emotional component, so that people know they're not alone, and they're not crazy, they're not strange, they're not abnormal. Can you speak from your experience and your patient's experience about the emotional component of dealing with fibroids?
Absolutely. And Broken Brown Egg is saying, Regina, July is Minority Mental Health Month also.
Oh,
absolutely. That's true.
You know,
I think the mental health aspect of fibroids, reproductive health in general, is really, really fraught with so many landmines, because the first thing is usually, just think of the word, like we talk about hysterectomy. Where does that come from? It comes from the Latin word hysteria. And that's because sadly, medicine back in the 1800s, 1700s, decided that the uterus causes women to go crazy. It causes us to have mental health issues. And so
I never knew that was the root of it. I never knew the root of it. Y'all.
And so hysterectomy was literally removing the thing that causes hysteria, hence the word hysterectomy. And that's supposed to normalize her. And so with that comes the fact that many people during their training would literally be taught that women get really hormonal, right? How many of us weaponize PMS? And we tell people you're PMSing right now because we've weaponized a hormonal change that happens with many of us during the month. Well, the same thing with that. So imagine realizing that you're having an issue with your hysteria organ. You don't want to go to the doctor. You don't want them to accuse you of being hysterical. You don't want your family accusing you of being hysterical. So you keep that silent. You're ashamed. You're afraid to talk about it, especially if you've already heard women in this family have heavy periods. You are no different. You're not special. Right?
Deal with it. Right.
Deal with it. auntie so-and-so, cousin so-and-so had her heavy periods and she still finished school. She still did this. She was still an inspector of police. She was, you're hearing about these high achieving women who supposedly were bleeding out and still did so great that now you're thinking, man, this is all in my head. I just gotta deal with it. But the truth is, it's not in your head. Your heavy periods are different for everybody. A period could be heavy for me, and I'm talking about 2 pints of blood, and it'll be heavy for you, and you're talking about 300, a soaked pad. It's still heavy, but you're talking about something different, right? So the same thing can happen in families. Your mom's heavy period may still be a different severity of heavy compared to yours. And I want people to know that. I think it's always good to have therapists involved, especially for people of color who also have other misgivings and distrust surrounding the medical system and medical care. There's a lot of distrust about when a doctor's talking to you about surgery and surgical intervention. There's a lot of fear there.
Yeah.
There are stories
and a
about,
valid mistrust, y'all.
It's a valid mistrust.
We don't judge the mistrust coming from this space.
No.
We understand the history of people of color in the medical community. We know. Yes.
Especially when it comes to reproductive care. Yes. It's built on systemic bias and racism on so many levels. The father of gynecology, we've talked about him before, Dr. Sims, he experimented on enslaved women. So it's not unfounded. But I want people to know that you can find a great doctor, as someone says here. You can do some research and find a great doctor. Don't let fear or distrust keep you home and cause you to get sicker or, God forbid, die and leave those who you love. And so it's very important, Broughton Brownhead said, also had people say things like your period would regulate once you have a baby. Oh, that's a very, very common myth. I got to do a video about that one.
Yes, because we've heard that.
Oh, over and over. The ones who tell you have a baby, the pain will go away. Have a baby, my bleeding got better. And I'm not going to lie, there are some patients for whom their perception of the pain they had with their period changed after they've labored. Their perception of what is heavy bleeding, because for some people, just the sight of blood is too much. And so in their mind, they just saw a massacre. And so, that changes. But that is in no way the same as the person who's truly hosing out every month.
Yeah, and something very key you said is their perception of the pain after they've labored, after they've given birth.
Yes,
you've gone into a different realm of the thing. Your perception of it may be different.
And so if you're someone out there who's had a baby and you feel like your periods got better, you feel like the pain went away, we applaud it, but don't use that to dismiss someone else's experience. Don't use that to dismiss someone else's complaint that they think their period's too heavy. Actually, in that moment, try to affirm them. Say, hey, let's get you in to see someone who can help with this. Have you gotten tests? Have they done tests? Do they know that it might take a few months before your body actually shows that you've truly lost that much blood? It's important to point that out. And, the other things with fibroids, many times the ones that cause heavy bleeding, meaning submucosal, the one sitting in the cavity, is...
That's inside here, correct?
Inside the cavity, So every time your lining sheds, which it's supposed to do when you have a period, it exposes the raw surface and blood supply of that fibroid. And that's why it's like, it's like cutting open a blood vessel. An actual artery, because it's not even a vein, it's cutting open an artery. And so it's just and people will describe that, right? They stand up and a gush
comes out,
they change position on the bed,
a fleshy chicken cutlet,
because the blood that was sitting in your vagina when you're in one position, now that you stand up, it formed a clot, and now it pops out. Now, I know there are people using that online and they're like, oh, see this is a melted fibroid. That's not a melted fibroid. That is too much blood that you just lost. That's what just came out. It's not a fibroid that melted. That's what that is. It's your blood, your life. Your heart needs your blood, and you just lost all of that.
That life source. Wow. Yeah. All right, Dr. Duke, we have a ton of questions in here. So I want to get to some of them so that we can do this here. Okay, we have a question. Why doesn't the medical establishment view fibroids as something that affects the whole body? why doesn't the medical establishment view fibroids as something that affects the whole body?
This medical establishment does. The American Board, the American Board of OBGYN actually recognizes that. But it's also why I started My Dynamic Uterus and why we talk about periods weekly, because we realize that education about the overall whole body effects of what changes with our periods and our cycles and our hormones aren't well understood or explained to most clinicians, right? The truth is, unless somebody is going into OBGYN and the subspecialties within OBGYN, their knowledge of the human body is taught during their first year, second year of medical school, and they see some clinical things during their rotations that they do during their third year of medical school, which typically is they're seeing the bread and butter, right? You want them to go see deliveries in case they're ever somewhere someone's delivering urgently, they can help. You want them to be able to recognize a life-threatening emergency, which is if you show up very anemic and having a heart attack, etc. They know how to recognize it, but not necessarily to sit there in the ER and educate you on what this all means in your body. Your emergency room doctor's job is to stabilize you, transfuse you, send you home, and now you need to follow up. So we want patients to know and families to know, and we're also working on the education. That's what we're doing. That's a big part of my education campaign, is to educate my fellow healthcare workers, because it's not just doctors. We need our midwives to understand the head to toe implications. We need our nurse practitioners, our physician assistants. We need nurses and medical assistants, because again, many of us, whenever we're talking reproductive stuff, even in medicine, we tend to dismiss by using ours, right? So instead of listening to you and you're telling the MA, yeah, I've had really heavy periods, they'll tell you, you know, my periods got better after I had my baby, and now you've been shut down. You forget to mention it to the doctor when you do see the doctor, because you're like, well, the MA already told me it was normal, so.
Interesting.
And husbands, yeah.
And husbands.
Or your husband may go tell his mom or his sister, because those are the trusted women in his circle. And they're probably going to just say, yeah, that's normal. Because again, 9 out of 10 Black women have fibroids. And so many of us have had symptoms related to them. And so that could be, you know, again, they're not meaning to do it, but they're going to say, oh, I had those. I'm fine.
Yeah, 9 out of 10. And we've normalized it, but we're not making it normal here on Warrior Wednesday.
Not anymore.
We're letting you know it needs your attention. So this question, I know that lady. That's Mama Stu.
Me too.
You know that lady. Well, Mama Stu is asking, what causes cramps? That's an interesting question, because I actually don't really know the answer.
It's a beautiful question.
Cramps? Yeah.
So cramps are actually the result of a chemical reaction in our body. Yeah, there are these special inflammatory hormones called prostaglandins that our body releases 2 or 3 days before a period. And that's meant to cause those blood vessels in the lining of the womb to dilate, to open up, so that the blood can come out quickly and then stop, right? Prostaglandins. In medicine, we've harnessed that knowledge, and it's now we use prostaglandins to induce labor, right? Misoprostol, which is being talked about in the aftermath of Roe v. Wade, is a prostaglandin. It's prostaglandin E2, right? There are different types of prostaglandins, but we've harnessed that knowledge to now use it, because prostaglandins, they do that to the uterus. They cause cramping. The uterus has muscle that's very similar to the tiny muscles that are in our intestines. So they also cause intestinal cramping. And so we use prostaglandins. If someone's got really bad constipation, we can give you the same medicine we can use to induce labor or complete a miscarriage. We can give you that same medicine. In fact, it was initially FDA approved to treat severe constipation, to help people have a bowel movement. So Mama Stu, it's a genius question, and there is physiology for it. That's the primary thing for cramps. And cramps are really so that your uterus, not only are you bleeding, but to help you slough off those things. The uterus has to cramp to release that stuff inside the cavity, to push it out, right? It's like a mini contraction.
See, I mean, what's so amazing about the body is that everything means something, right?
It means something.
It has to do that, so it means something. All right, let's go here. Someone is saying to us, I don't know if it's a question or a statement, my best friend has fibroids. She was recently hospitalized for 2 days from losing so much blood, and her hemoglobin was very low. I don't think she went to her OBGYN to follow up. She says they'll give her birth control pills. What is her best option?
Well, she needs to see an OBGYN. Really, when it comes to fibroids, there's no one else who is actually certified to treat this stuff and treat it well and with a spectrum of options. Now, your friend may actually need something like birth control or something else to temporarily stop her periods so that her body can recover. Listen, if you had to be hospitalized for heavy bleeding, or you needed, you know, because of course you could be like me and you get transfusion and up and leave the hospital before they have their chance to observe you for 23 hours. But if you needed a transfusion, you have hit point critical, okay? You've hit point critical. You should not be bleeding the next 3 to 6 months, because that's how long it takes your body to actually make red cells, okay?
Okay.
To make red cells. And so you might need something like birth control pills or a special injection or something to stop your body from bleeding for a few months so it can recuperate and save your heart. This thing here, you only have one, and there aren't that many available, right? Most people, sadly, who end up on a heart transplant list never make it to get the transplant. And many times when young women end up on a heart transplant list, that's part of it. Period-related stuff that puts so much strain on them. Yeah, I know, mind-blowing. So we need to keep that in mind. So your friend needs to see the OB-GYN. If she's adamant that I'm assuming she's she, I think you use those pronouns. If your friend is adamant that they don't want birth control pills, they need to be aware of what their other options are. There's no point in her getting a transfusion and then bleeding out all that blood that somebody generously donated for her to save her life over the next 2 months because she's not doing anything about it.
Wow. Okay. So she just said, thank you for answering that question. And I thank you, because I just learned so much there. A lot of people have skepticism about birth control pills, and maybe we'll get into that today or on another live. But what you explained so geniusly is that sometimes in cases like that, the birth control is to stop the period so her body can recover and that she doesn't actually bleed out the transfusion that she just received to save her life, y'all. So this is huge. Okay, so we have a question. We have a lot of questions here, and I think that that's great. Let me see. It says, often fibroids will grow again after myomectomy. What are some new research that they have for treating fibroids? We talked a little bit about that, but I would like you to get into the fact that fibroids grow sometimes after
fibroids come back.
Yes.
So, you know, fibroids are small tumors. They're benign tumors. They're not cancer. Now, there's a name that sounds familiar to fibroids, or a medical name for fibroids are leiomyomas. And there's a cousin of that known as a leiomyosarcoma. That's a cancer. That's an aggressive cancer. And so certainly if you were told you have a fibroid and it's growing rapidly, meaning if you were told like you had a 2 centimeter fibroid in January and come December, your fibroid's like 6 centimeter, 8 centimeter, 10 centimeters, people need to take that seriously and act on it, and not just sit and say, oh, what are you doing? Are you taking hormones? No. Even in the face of estrogen, a fibroid should not be growing from 2 centimeters, which is the size of a cherry, to a grapefruit in a few months. That shouldn't be happening. So I want to make that distinction very clear, very early. Now, secondary to that, okay, so you've been found to have a fibroid. Like I said, not everybody with fibroids will have symptoms. So the first thing you want to do is have a conversation with yourself and your clinician to figure out whether or not you just happen to have an incidental fibroid, like I talked about earlier, which is they just incidentally see it, but you're not having symptoms. Or are you actually having symptoms like we talked about related to heavy bleeding or the bulk stuff that we talked about, or visible, meaning people are coming up to you and asking, when are you due? Because your belly is now so big. Those are all signs that, okay, this thing is now symptomatic and needs to be addressed. Fibroids will naturally shrink after menopause, and that's because your ovaries actually will stop making estrogen. But if you're what I call remote from menopause, meaning 2 years or more before menopause, many times we need something. So if you're in your 40s and menopause might be not far away, we might just talk about medications, Kelle, which is things someone can go on to regulate their periods until their body naturally goes into menopause. But if you're in your 20s or 30s, menopause is likely 2+ decades away. And so we may need to talk about more than just things like birth control pills. Or when we say birth control, by the way, we're usually just talking about progesterone containing pills. So it doesn't even have estrogen, which is a big misconception out there. Everybody assumes birth control means estrogen, but it does not. We have different combinations and formulations for pills. And I think that's also one of the disservices that we did by calling all hormonal pills birth control. Because now it's been weaponized and it's been turned into such a negative term out there that people don't realize hormones have different functions, and sometimes we use those medicines to lower the total amount of hormones in your body so that your fibroids can actually either stay the same or sometimes even get smaller. So we have medicines, but also there's fibroid embolization surgery, which is a procedure done by a specialized radiologist known as an interventional radiologist. And basically they shoot off little things that go off and cut off the blood supply to the fibroid.
This is the fibroid and this is the blood supply. The embolization zaps it.
Just zaps that. And so it'll stop the blood flow. And if the fibroid isn't getting hormones travel in blood. And so if we cut off its blood supply, we've now cut off the hormonal supply, the fertilizer that grows the fibroid, and hence they shrink. Now, we don't recommend fibroid embolization in someone who for sure knows they still want to carry another baby. And that's because especially if you have a lot of fibroids, if we cut off too much blood supply, it might not be enough to support a pregnancy in the future. And so this is important. If you're someone who absolutely knows you're going to be planning to have babies in the future or carry a pregnancy, we don't recommend a fibroid embolization. That doesn't mean that people who've had fibroid embolizations haven't gone on to have babies. Many have, but many have also miscarried because they just no longer have enough of a healthy uterus to support or sustain the growth of a baby. Make no mistake, a baby by the time it gets to 30 weeks needs 40% more of your blood supply. It needs a lot.
And those fibroids are taking it up.
They're taking up, especially if you got an embolization surgery. Now, not all the blood vessels that usually feed your uterus are available to the uterus anymore to feed the placenta. So we don't recommend that. The other is you can actually do what we call radio frequency ablation of the fibroid, or something known as the accessa, ACCESSA. Accessa basically means you're going to have laparoscopy, which are tiny cuts on your belly. And then the doctor is going to go in with the camera, but also a specialized ultrasound delivery system that's going to deliver sound waves that heat up the fibroid and start it to melt almost, but it's not melting. But really what it's going to do is compromise its blood supply. So over time, it shrinks. Accessa is safe. It's actually safe to use even in someone planning future pregnancy, but it's limited in terms of how much can be done. So again, your doctor and you have to choose the right option for you. I know there are patients who show up and they're like, I absolutely need a fibroid embolization. And then they get angry if the interventional radiologist says, I don't think this is the best one for you. So for example, if you have a fibroid that's sitting in the cavity, embolization doesn't really work on that too well, the submucosal fibroid. That's where you might actually need a surgeon like myself to go in through the cavity and shave that down in a procedure known as hysteroscopy. There are no cuts or anything on your belly. You go home same day. That's one version. Or you might actually need a full myomectomy where they make a tiny C-section type cut on your belly, and they go in and they really feel on the uterus and feel and palpate and remove as many as they can. The most fibroids I've ever removed from one uterus is 63. That was a 4-hour plus surgery. It was a 4-hour plus surgery. I've had surgeries where I take out 50 something. I've had surgeries where I only take out 3, but they were so massive. They're like bowling balls, those little bowling balls. And so the patient was just uncomfortable. I've had patients where before surgery, I give them medicine to sort of shrink their fibroid and their uterus so I can still make sure I go in and not have to use a massive up and down incision on them. Right? You know, if it's really important to my patient, maybe she's a model, maybe she needs to be able to bear her belly, first of all, I generally don't like making up and down. So we talk about that. I also work with patients so that they can donate blood to themselves before surgery. So for those who are very scared of transfusions but don't have like a religious thing against transfusions, that's something we can do. If you're someone, say a Jehovah's Witness, and you need fibroid surgery but you absolutely can't even donate blood to yourself because that's not allowed for the strictest practitioners, you can actually use something called a cell saver during surgery, that basically they connect to your vessels, and it circulates any of your blood coming out, extracts the red cells and puts it back into your body, so it remains a closed system.